My name is Brett Osborn. I'm a neurosurgeon with a secondary certification in anti-aging and regenerative medicine. I always liken it to that which is occurring in a car engine. Byproducts of our metabolism are accumulating over time. And these byproducts, just like oil residue inside of a car cylinder, accumulate and ultimately do damage. And if you're not actively trying to dampen the effects of aging, in other words, changing your oil, exercising, eating properly, then this degenerative disease of aging will ultimately result in the diseases that are most likely to kill us, and that being the effect of atherosclerotic disease, which is the most common cause of death, at least here stateside, is coronary artery disease, heart attack, and secondarily things like stroke. But these are all diseases of our arteries. We're only as old as our arteries. If your cooling system goes bad, you're going to have problems with your car. It's going to overheat, et cetera, et cetera. We have the same sort of thing inside the body, except these free radicals, when they escape the normal enzymatic systems that we have to quench them, they'll go and they'll poke holes in the cell walls. They'll damage the cell walls. The next thing you have is an inflammatory response. And when you have inflammation, you have aging. Okay. To anti-aging people, we call inflammation inflammaging. Okay, because what ends up happening is that if you have ongoing inflammation in the body, a lot of these processes which do deleterious things to the body itself are accelerated. So if you're living in an inflammatory milieu, so to speak, if your body is inflamed, you're going to develop accelerated aging, and you're going to be predisposed to development of age-associated diseases or age-related diseases such as hypertension, diabetes, Alzheimer's disease, cancer. They're all age-related diseases. Their underpinnings are inflammation and oxidative stress. Means or mechanisms or modalities through which we can dampen inflammation. It's like adding coolant to your car, and we use things like high dose omega-3s. I use aspirin very, very liberally, and there are a whole host of other supplements and pharmaceuticals which can dampen the inflammatory response. And if you have control of bodily inflammation, you to some degree have control of the rate at which you're aging. If you're going to attempt to thwart age-related brain degeneration, number one, number two, number three on the list would be exercise. Okay, all the beneficial effects of exercise on the brain, in addition to the rest of the body, but on the brain as well.